Brilliant. So that's live. So hi, everybody. This is Dr. Claire from Cognitive Sports Therapy. Thanks for joining us. And I have Dr. Tommy Wood with me today. Tommy, I maybe won't do you credit with what I'm going to say, but you're a medical doctor. You have a PhD in neuroscience and physiology from Oslo, and you are assistant professor at University of Washington, doing lots of research into brain health, I guess. But you work within the sort of neonatal department at UW, and so you are basically a brain scientist. So,
yes.
Yeah, to go into that. And I think what I said to you before this, like, where will we go with this conversation? I said it's 15 minutes, then you went, 15 minutes isn't very long. And I kind of I've listened to a lot of your kind of videos and things actually in the last few days, just to kind of get up to speed with what you have been researching. But you kind of put it to me about talking about what you're doing most of your research in at the minute, about sort of brain exercising, almost, is what I heard in what you said to me. Is that, do you want to tell me a bit about what's going on in your research at the minute?
Yeah, sure. So this is not something that we're directly testing in the lab. When I'm in the lab, we do various models of what we call acute brain injuries, so strokes, concussions, things like that, across various times of life. But something that I've been working on with a friend of mine, Dr. Josh Turkner, who's a neurologist in Georgia, in Atlanta. We've been trying to put together a picture of what's really important to prevent cognitive decline later in life, and then eventually, which sort of, in the majority of people, if they live long enough, it turns into dementia. And this affects memory, executive function, and what we kind of see is that the common causes of what some people may call Alzheimer's disease, which is probably not true Alzheimer's disease based on what Alzheimer described, but that's a technicality. But what we're seeing in the majority of people who have dementia, what many people would call Alzheimer's disease, is it's clearly driven in majority by the environment that we live in, right? There's a genetic component that maybe changes risk, but that even requires the environment in order for the genes to really play a role. And there's lots about lifestyle that makes a big difference. So we know that sleep matters, diet matters, smoking matters, alcohol matters, exercise matters. And people talk a lot about those things. But what seems to be really critical, like the single most protective thing, is using your brain, right? Is creating a demand on the brain, cognitive demand, that then, drives the brain to become better, more resilient, and have more capacity. And the reason why this makes a lot of sense to me is because I'm an athlete, and that's what you need to do as an athlete, right? You need to train to make your muscles bigger, or your cardiovascular system more robust, be able to deal with more oxygen, drive more nutrients through it so that you can perform faster or longer. And the brain is essentially the same. And we see this in multiple areas. So early in life, the amount of education that you get is a significant risk factor for later cognitive decline. And there's a bunch of socioeconomic stuff that plays a role there as well. But it seems that, the more education you get, which is the more cognitive demands you're putting on your brain early in life, basically creates more capacity and headroom in terms of brain function that then creates some robustness later in life. And similarly, the more active you are with your brain later in life, the more protected you are. And the best way to kind of see that is that there are multiple studies now that show that as soon as you retire, your cognitive function rapidly declines, because most of us get most of our cognitive demand. We use our brains most through work. And when we lose that, that's when we see this sort of trigger for cognitive decline. So there's, throughout the entire life, cognitive demand seems to be this really important aspect of long-term brain health.
And can we, so say the person who is heading to retirement and wants to retire early, can they replace that occupation with hobbies, interests? I mean, I've heard the word mastery, can we switch on our brain cells in the same way by other things?
Yeah, absolutely. I think what people traditionally do, they're like, do the crossword, do some Sudoku, and that's good, but I'm not sure that's enough. I think that it really has to be this process of skill development, which usually means that you're bad at something and you spend time being bad and you struggle and you get better. Again, similar to exercise, to get better, you need to sort of keep pushing, adding volume or adding strain, right? So that you continue to adapt. And I think this is the same here. But there are a number of different ways you can do that. So learning musical instruments, learning languages, movement is beneficial, particularly if it has a coordination aspect. There's some meta-analyses that show that. So maybe yoga, dancing in particular seems to pop up again and again as being particularly beneficial because, again, there's this additional challenge and sort of skill-based mastery component that seems to be particularly protective.
So what if I said, so I'm a mid-40s-year-old woman, and I would really struggle, I think, now to learn a new language. I'm like, my brain actually doesn't seem to work in the way that it did. So is there, can we extrapolate something from what we know about fitness, that actually the sort of exercises that you would do when you're younger are different to what you would do when you're older? Like, I don't want to get myself stressed about learning a language here, but what can we learn?
So actually, I think, we've been told this story about how the brain is really good at learning when you're younger and it gets bad at that as you get older. And there's a very small component to that. But in general, I'm going to say that's not really true.
Okay.
What's true is that kids, have this thirst for learning, and they also don't mind being bad at things when they try out new stuff. Like, they're just bad at it. They don't mind, right? If they try out a new language, they'll speak and they'll make errors, but they'll keep doing it. Whereas an adult is scared of looking stupid or is scared of looking bad at something, right? So then they shy away from that process of failure, which is a necessary process, of learning. So what, if you're then scared of that, right? I appreciate that's something that people are going to have to overcome. So it's just making sure that, well, either you pick something that you don't mind being bad at, right? That's the starting point. Or you make sure you're in an environment where it's okay to fail, right? And that could be, if you're doing it at home alone to start with, that's fine. Nobody's there to see you fail. Of course, you'll probably learn more, say, with a language if you then go and partake in conversations with other people. But maybe those early steps you can do without having to be worried about, looking like you're failing or bad at something in front of other people. But I think that's what's holding us back.
So we're holding ourselves back. Interesting.
Yeah, exactly.
So it's not that I've got this kind of view in my head that I have less brain cells now than I did when I was younger, and actually it is harder. There's no evidence.
That's not really true. No,
Interesting.
that's our learned response. We're told that that's what happens to our brains as we get older. It's not true. We just get less willing to try and fail things.
Okay. And then the other thing you kind of were saying that the other thing that's important in this is not just about working and working and working. A similar analogy to exercise, that need to have rest and recovery in there. Do you say something about that?
Yeah, exactly. And because, if I say cognitive demand is important for long-term brain health, you might think, well, my brain is busy all day anyway, right? So maybe that's enough. But in reality, what you're busy doing are the same things over and over and over and over again, and probably under some kind of time pressure. You're not really learning, you're just stressed, and the skills that you maybe do perform on a daily basis, they're already sort of ingrained into us. They're no longer a challenge. And so we know that work-based stress is associated with worse cognitive health later in life, and particularly if we don't have any control over it. So the real difference is, you may think that your brain is busy all day, but you're probably not in the process of learning new skills. Because when you do learn new skills, you probably can only really work hard at it for like 20 or 30 minutes. That's like the length of attention span that we have, particularly if we're sort of struggling, during that period of time. And then you need to rest and recover, just like an athlete just can't keep training and training and training. They only benefit when they recover. So that rest and recovery is, obviously doing something else, switching off, sleeping, critically important to the learning process. So I think about skill development as I would think about lifting something heavy in the gym, or going for a run or a bike ride. If I'm trying to improve my performance, is that you push hard for a short period of time relatively, and then you need to rest and recover and sleep in particular.
And can we extrapolate this into other areas? So I guess when I think of cognitive disorders at the minute, I hear a lot of people talking to me about brain fog related to perimenopause, for example, or brain fog related to COVID, for example. Are we talking about using what we know to help that as well? Because I guess that's coming a little bit into almost brain injury. Is that?
So it can be, certainly there is some data that suggests that COVID or long COVID is associated with changes in the brain, and there's this sort of, either peripheral or local immune response that may be contributing to part of that, as well as nutrient dysregulation and histamine, and it's associated with differences in the autonomic nervous system and all that kind of stuff. But I think similar things can apply, and what just like if you detrained from I'm just going to keep pushing this exercise analogy.
Okay.
So if you just lay in bed, right, you go on bed rest, or you say you break a limb and it goes in a cast, over a period of time you're going to lose muscle and strength.
Yeah.
Right. And the brain is the same. So if you stop using it, especially in the context of some kind of illness, you're going to lose capacity and function, but you can regain that. That's the important thing to remember. But what often happens, and it's the same when athletes get an injury and then they try and train again, they think that they're going to be able to do everything that they could do before they stopped, right? But we know that's not possible. And I think cognitive performance is the same. So you need to build up slowly. Don't expect everything of yourself straight away, but keep the challenge relatively consistent. So, even on days when you don't feel great, try and do a little bit. And, maybe on days when you feel really good, don't do too much. And you try and keep that consistency, then slowly build up over time. And I think that's relevant here as well.
Yeah. And the pacing, and then obviously that recovery time.
Yeah, exactly. And then rest and recovery important as well.
And do you, because I guess a lot of what I work with is mental health. So can we go, sidestep across and go, does cognitive health equal happiness? Are we able to kind of go, if your brain is healthy, does that, or is that just a different part of the brain?
They're definitely associated with one another, and we know that some aspects or some mental health diagnoses are associated with physical health problems. So, say some proportion of depression is associated with systemic inflammatory response, maybe a third of cases or something like that, and that also affects cognition. And those who have things like depression have altered cognition. And we also know that if you're diagnosed with depression, you have an increased risk of later cognitive decline and dementia. So these things are definitely interrelated. And I think if you look at sort of like the underlying mechanisms of how demanding more of your brain then improves structure and function and repair processes, then, nothing is a panacea, but I think that applying some of these sort of skill-based learning processes, increasing demand on the brains in sort of manageable chunks with periods of rest and recovery, I think that can improve everything sort of holistically, because of the way that increasing demands on the brain then improves downstream function.
Yeah. And I don't know whether there's anything there in the skills having to be new. So do you advocate changing around what you're doing? Again, if you want to do the physical kind of mirroring, sometimes there's something like cross training. Is there a thing about cross training our brains as well?
Yeah, everybody talks about the interference effect in athletes, where if you train, say, to build muscle and endurance, then they sort of interfere with one another. But in reality, unless you're an elite athlete, that doesn't really matter. So I might say something similar here. So in studies where they've looked at people who've done some very intensive skill-based learning, so particularly those who focused on memory, right, their memory got incredibly good. And actually the parts of the brain that are associated with memory, they increased in size, right? So their brains got bigger in the parts of the brain that are associated with the process that they were using, but they got less good at some other cognitive skills because they've literally channeled everything into memory. And so this makes sense. Like if you're going to go run a marathon, you're probably not going to be able to deadlift as much, right? And so this does kind of make sense. But for most people, I think a bit of everything is fine and probably good, right? Skills across a broad range. What's important is that when you get good at something, it no longer becomes a challenge, right? So once you become really good at the skill that you've learned, then is the time to switch it up. If you can keep getting better in the thing that you're learning, then it remains a challenge. And a nice example of this is they looked at brain scans of musicians, and they saw that those who are amateur musicians had younger looking brains compared to professional musicians, even though both were sort of got benefit from the music compared to the general population. And the theory was that it was harder for amateur musicians because they're less good, whereas a professional, they're very good at playing their instruments, so it's less of a challenge. So I think the important thing is continued challenge, continue getting better. And if you get to the point where something is, so then it becomes automatic, then it's no longer a necessary challenge, and then you need to switch it up.
Yeah. So are you, sorry, we probably need to wrap up. It goes really fast, but do you kind of think that, because I still have this thought that everyone's brain capacity is going to go to, like, again, if we think of athletes, we have a peak and then we can't stay at that peak. We can't, even if we're training at the same level. So are we just talking about sustaining and maintaining here with cognitive ability?
So it's true, like everybody's cognitive function declines over time. Like cognitive function decreases linearly over time. It's, all functions except for maybe the ability to like remember the good old days, like that kind of stays pretty flat, interestingly, but all other functions decrease over time. I think the case that I would like to make is that you can either slow or reverse that by making sure that you're applying adequate cognitive demands. But just like saying, if you want to peak for performance in the triathlon, right, you're going to spend several years training, and then within a season you're going to periodize your training so that you like peak on the race date, right? Nobody really cares about that with cognitive function. We just want to have this good baseline, function over time. Like, it's not that you want to show up and win the race. It's maybe that you want to show up and just be able to complete the race on a regular basis, right? Not that you're sort of winning or at the elite level. And I think that's what people want from their brains. And I think that's the same as just continued regular exercise throughout your entire lifetime. I think of this as that for the brain.
Brilliant. Awesome. Thank you so much. I mean, I think we could talk all day. I was saying that I'm a bit scared about some topics that you might know more about than me, like things like nutrition, and maybe I'll get myself ready with some information to do that conversation. But thank you for joining me today. I always say at the end, if anyone's got any questions, please feel free to contact me, and I can obviously send them over to Tommy.
Awesome.
And this is available to view afterwards on our YouTube channel. But thanks for joining me, Tommy. And
thanks for having me.
Have a nice day.
You too.
Bye-bye.